Hi, my name is Janette, and I'm a patient at Valley Medical Center. Well, when I first came to Valley Medical, I had an internal medicine doctor. I had concerns about fibroids, and my internal medicine doctor suggested I see a specialist, which is Dr. Swensen.
My name is Ron Swensen. I'm a gynecologic oncologist. A gynecologic oncologist is trained in OBGYN and then further subspecialty training, typically 3 or 4 extra years, to learn the skills of advanced cancer surgery and treatment using chemotherapy, immune therapy, as well as coordination with radiation. I first met Jan when she was referred to our office to evaluate postmenopausal bleeding. That's a symptom which could be evidence of a malignancy, although usually it's not. When we saw her, I attempted to do a biopsy in the clinic, but found it too difficult to achieve, and so we arranged for a surgical procedure where a scope was inserted into the uterus and a biopsy obtained. At that time, there was no cancer, but there was some excess growth of the uterine lining, and so we treated it with hormones. A few years later, the symptoms recurred, and so we performed another biopsy, once again in the operating room, and at that point, an early malignancy was found.
It's interesting because I had some abnormal bleeding here and there, but it had been quite a few years. So having gone through menopause, perimenopause, and when I came to him that afternoon, I said, hey, I haven't bled in years. This is crazy. I should be having periods. He said, let's do some testing, and came back a couple weeks later and told me it was definitely endometrial cancer. Honestly, I was stunned. I kind of went numb just sitting there in the examining room. It was echoing the word of cancer in my head because a lot of people think it's a death sentence, but at least it was found. I had to look on a positive, and I had to get my head together about what are we going to do. And at first I was thinking, why me? And then I just was ready for the next steps.
Endometrial cancer is now routinely treated by using minimally invasive surgical approaches. I'm old enough to remember when we always did incisions that were large enough to do a more traditional hysterectomy. Unfortunately, that was more commonly associated with side effects such as infections, and it took longer for recovery to occur. Valley Medical Center is a center of excellence in robotic surgery, and part of that includes frequently using the robotic surgical tools to provide hysterectomies or other surgeries for female cancers. Janette had that particular procedure done for her case.
I had to have a total hysterectomy. Dr. Swensen had advised would be a robotic type hysterectomy. I guess that's different from years ago when women just assume it's a incision straight down the middle of your abdomen, but it's a little different, faster recovery. And so that's what I was excited about. He just explained everything fully.
Robotic surgery requires a skilled team, not just the surgeon. So our anesthesiologists have to be familiar with positioning. The staff have to be trained in robotic surgery so that they can have the instruments available for the surgeon as it's needed. Valley does a fair number of robotic surgeries, and so the team is quite skilled and prepared for this.
But everyone was so kind, from admitting to saying, we're getting you ready for surgery. This is what's happening at this point. And just from the recovery, when I woke up, my child was there. The nurses were great. So everyone took care and time with me, and I felt so much better. I just want to say special thanks to Dr. Swensen and his medical assistant, Gina, because when I first heard the word oncology, my specialist, I'm thinking, I don't have cancer, what's this? And then I had to relax. There's a reason that he's in GYN oncology, because it's about women's health issues. And he made me feel comfortable from day one. His medical assistant, Gina, did as well. And he shared when he took different screens. He showed me on the computer what was happening. He explained a lot of the medical lingo, so I felt comfortable and asked him questions why. So through the whole process, he's a delight to work with, and he's a great doctor. It's interesting because I always love life and love living, but when you on the other side of cancer, when you're on the other side of it, you think about life is so precious, even though that's a cliche, and a lot of people say that. During my recovery, laying there on my back, it was a 6-week recovery, and I'm thinking about what I just went through. I woke up, I'm staring at my ceiling, and it came back to me that initial when he said you had cancer, and I said, why me, why not me? And I thought I'd write about it and tell my own story. So I wrote a book called Cancer, Why Me, Why Not Me? Don't be afraid, because as women age, they go through menopause, perimenopause, we figure, oh, I have another breast exam, or I got to go for a pap smear. That's your body. You're only given one body. Don't be afraid to go to the doctor. Do research, learn about yourself. And as you age, we have to think about the people we love. We can't be selfish, like I don't need to know. You need to know for your people that are in your family. And also it's about educating your community and taking a mother or aunt or a sister to the doctor and finding someone you can trust in a hospital that you can trust.